Hi, my name is Dr. Natasha, and welcome to Let's Talk About It. Today's topic is going to be high blood pressure or hypertension during pregnancy. So, we're going to talk about two particular conditions today. One is chronic hypertension, and the other is gestational hypertension. So, the difference is one is diagnosed outside of pregnancy, and the other is a condition that is exclusive to pregnancy. So let's start with chronic hypertension. So chronic hypertension is women that have elevated blood pressure. So the top number above 140, the bottom number above 90, and that can be either or. And you have those blood pressures before you get pregnant or at any time during the first 20 weeks of pregnancy. It's also very important to remember if you were diagnosed with chronic hypertension before pregnancy, you still carry that diagnosis even if you're taking blood pressures medication and your blood pressures are now normal. So that is something you definitely want to make sure that you share with your healthcare provider, whether it's an OBGYN or midwife, that you have a history or you've previously been treated for hypertension or elevated blood pressures. The second condition we're going to talk about is gestational hypertension. So unlike chronic hypertension, gestational hypertension is something that is exclusive to pregnancy. So we diagnose gestational hypertension, again, if your top number of your blood pressure is above 140 or the bottom number is above 90. It can be either or, but those elevated blood pressures happen after the first 20 weeks of the pregnancy. For women who are diagnosed with gestational hypertension, you do require very close monitoring of your blood pressure to determine if you're going to eventually develop a condition called preeclampsia. And so preeclampsia is something that we'll talk about in another episode of Let's Talk About It. But gestational hypertension, you may or may not need medications during the pregnancy. That is something that you and your provider will certainly decide in terms of the best management or plan of care for you. Now, when we talk about chronic hypertension and gestational hypertension, in terms of future implications. So one thing that you want to remember, chronic hypertension does increase your risk for heart attack, stroke, kidney disease if it is untreated. And this is even outside of pregnancy. For women who were diagnosed with gestational hypertension, you are also at increased risk of developing chronic hypertension later in life. And again, high blood pressure puts you at increased risk for heart attack, stroke, and kidney issues if it's untreated. So for people who have been diagnosed with either form of hypertension, it is important that if you have been prescribed medications to control your blood pressure, that you take those medications as prescribed. You follow with your doctor yearly to make sure that you are still responding to the medications and that your blood pressures are normal. We also recommend healthy, good quality, nutritious meal choices, food choices, diet choices. We recommend maintaining a healthy weight and being physically active and participating in the exercise program. And then also you want to make sure that you avoid certain lifestyle choices that can cause an increase in your blood pressure. For example, smoking or excessive drinking. So thanks for tuning in. I hope that this has helped to shed some light on the difference between chronic hypertension and gestational hypertension, how we reach those diagnoses, and then risk for the future, for your future health if these conditions are not well controlled. So thanks for tuning in. Please like the video, leave a comment. If you want interested in future content, subscribe to the YouTube channel. Again, thanks for tuning in to Let's Talk About It. My name is Dr. Natasha Lowe Osho. I'll talk to you next time.